Hi, I'm Bill, the knee pain guru, and this video is going to focus on how the Quit Your Quack pain relief program can help with a diagnosis of bone on bone. Now, at this point, you've been in pain for a while. Bone on bone is usually a case of arthritis or osteoarthritis that's been wearing away the joint for a period of time. So it's crucial we move forward as quickly as possible by first and foremost creating comfort in your knee. This happens by getting the pressure off of the nerves that are causing the pain. And I know there's this idea or this mentality that there's no space in the joint, and that's what's causing the pain. And you have this bone-on-bone diagnosis. But I would challenge you to think, would you care what your diagnosis was if you didn't have pain? Would you care what your diagnosis is if you had complete flexibility and mobility in your knees? And I want that to be first and foremost in your mind as I continue in this video. So when we start creating comfort in the knee, first of all, when the knee's in pain, it's squeezing very tight. It hurts, it aches to move, to sit, to stand, whatever it is. So there's lots of tension in the joint right there. Think of it, when there's lots of tension in the joint, it's squeezing out the synovial fluid in the joint, causing the joint to be dehydrated. So all diagnosis of arthritis is dehydrated joint. The synovial fluid is squeezed out. That means the joint gets dry and brittle, and when you walk, it's rubbing and wearing away at the meniscus, at the cartilage in the joint. Once we begin to get the pressure off of the nerves in the knee that are causing the pain, the joint relaxes. When the joint relaxes, it creates a little bit of space. At the same time, we want to make sure you're drinking water so the water can start getting in the joint and lubricating the joint. There's a system, there's a priority in what we're doing, and it's very specific in terms of how your knee feels as to the results we're getting. So based on you getting more comfortable in your knee, we know we're progressing. We're moving in the direction of getting you your life back so you can have that normal active lifestyle. We also have to take into consideration, is your body absorbing the water that you're drinking? Because you can drink the water and it can run right through you and you're going to the bathroom 5 minutes later. That generally points to a mineral imbalance that's going on in your body, that when we bring it back into balance, it allows the cells of your body to get the water from outside of the cells to inside of the cells and flush everything out so it can things start functioning more normally. At the same time, we're still continuing to create comfort. And what's most important, especially with a diagnosis of bone on bone, is we have to look at the tension patterns that are going on in your hips and your lower back that are contributing to what's going on in your knees. So that's going to look like you're going to have tight hamstrings, possibly tight quads. IT band's going to be real tight. That's the tendon that goes up and down the outsides of your legs. There's probably pain in your feet as well. All of these areas of the body we need to look at to begin to create comfort in these different areas. That's going to take the pressure off of all of the tension going down into your knees. Because when you step, you get that bone-on-bone smacking feeling. And once we restart establishing the tension in the rest of the body so your knees aren't taking the brunt of it, you're going to start feeling relief on a consistent and a regular basis. We're going to focus on making sure you're able to sleep better, because bone-on-bone knee pain is going to hurt pretty much all the time. So the more relief we can start focusing on comfort in these different areas of your life and setting up the conditions in your body so your body can heal your knees and keeping you in the right mindset, which making sure you're not sabotaging yourself in the process, wink, wink, nudge, nudge, meaning the moment you get out of pain, I don't want you going and doing something that's going to throw your body right back into pain, which could look like running trying to run 5K, or playing 5 sets of tennis, or 18 holes of golf, or something like that that's going to put your knee back into pain, because we'll get to that soon enough. We have to ease you back into your life and test your body when we've built the confidence to get you out of pain, and you can get yourself out of pain. So it's not like you do something and you're in pain for weeks afterwards, days or weeks afterwards. We want you to start creating comfort, build the confidence that you can create comfort in your knees, and then start easing your activity level back, so if something happens, we can go back and start creating the comfort in your knee to get you back to your lifestyle. It's more of a systematic way of intelligently easing you back into your life, increasing your activity level while building your confidence to get your knee out of pain, knees out of pain in the process. So I hope you join the program. That's how I would approach Bone on Bone. When you start, begin with the Getting Started guide, and then on our very first call, we would get into customizing the program based on where it hurts in your knee, where the tension is in your hips, lower back, ankles, feet, hamstrings, quads, calves, or shins, whatever it is. So, Bill Paravano, the Knee Pain Guru, thanking you for listening to this video, and I sure hope to see you in the program.